Namaste to you. I would like to share my experience and thoughts on PCOS or PCOD, polycystic ovarian syndrome or polycystic ovarian disease. This is such a rampant condition, so widespread in its occurrence, and it's really having a devastating effect on the health of the ladies of the age group of 20s, 30s, and 40s, which is basically a reproductive age. The horror of the fact is that easily about 10% of the female population suffer from it. And to make things more complicated, easily about 40% of them fail to conceive. So obviously it has not only physical trauma in their mind, but also they have a psychological impact that is very depressing in nature. The fact of the matter is also that even though this is a bit notorious in its nature, Ayurveda has a great role to play in it. The science of Ayurveda helps in healing of this condition. It easily takes 3 to 6 to 9 to 12 months for somebody to totally get over it. And it is not necessary that only those who have sedentary lifestyle and wrong food habits get into the obesity segment. There are many ladies who have PCOD even if they are lean enough. This makes it very important to make sure that we have a clear strategy to deal with this situation. It's also very noteworthy to realize that in spite of the best efforts from the allopathic system, the modern medicine system, the cure of PCOS remains a bit unsatisfactory domain. But the fact of the matter is, by Ayurveda, most of the patients do conceive. Easily about 90% of them would conceive, leading to a meaningful pregnancy. And interestingly enough, nearly 95% of them are able to keep away from diseases that can come out of the PCOS scenario. It's not just about the statistics of this. What is also relevant is the fact it is one of the major causes of infertility in today's society, and that's not only having a depressive effect on the body but also on the mind. But we need to be very sure of the fact that it is very common for many doctors in Ayurveda to come across PCOS patients, which would be actually a situation of tumor of the ovary or the adrenal glands. It can be situations of high prolactin levels in the blood. It can also be situations of hypothyroidism. So it's very important to come to a proper conclusive diagnosis about the patient that you are coming across. Of course, it is always a disturbing trend to have high levels of luteinizing hormone, which is the LH at its short form called, which leads to higher chances and, regretfully enough, higher recurrence of miscarriages, and that is always very depressing for anyone. So other than the simple aspects of what we would call as the triad of the hirsutism, like facial hair or mustache or beard, and of obesity and of amenorrhea, there is more to PCOD than this triad itself, which means it can definitely affect the health of a lady from the point of view of reproductive, yes, but beyond that, it can get into the metabolic domain. It can give rise to more other complications which are definitely not desirable. And the good news is always, as I had mentioned before, it is usually a curable entity, and there's a lot of homework the lady has to make other than the medications that an Ayurvedic or any other physician of any system of medicine would be doing for the patient. So this brings us to the point how to come to a reliable conclusion about the diagnosis. Having the apt diagnosis is the most important element in any disease, and obviously PCOS cannot be an exception in that. So coming to the diagnosis, it's not just the missing of your monthly cycles that matters, the amenorrhea, but also we need to be very concrete about the investigation done. Doing ultrasound abdomen pelvis would be one of the easiest and the cheapest methods. And obviously we look out for, any physician would look out for enlarged ovaries, look out for cysts which are CYSTS cysts, more than 12 in number, more than 5 to 6 mm, the so-called necklace pattern, the classical textbook picture. So these things are there obviously, but more than that, what becomes relevant, this of course relevant, is the fact that if the lady has more than 90 centimeters abdomen girth, and if the lady is on very high sugar levels, high cholesterol levels, and even the hypothyroidism angle, these all have a big implication in the health of the lady. So just the cosmetic appearance of the mustache or the beard or the pimples on the face of the lady is not the only criteria to be worried about. It's also a matter of fact that when the gynecological angle is being taken care of and being viewed and pursued, many times the cardiac health becomes undetected or unexplored, and that is a real trap, and that can lead to a red flag. And that means that a lady's health has to be focused not only just the PCOS angle, but also the other departments of health and systems of the body that need and deserve equal attention. This is why the role of Ayurveda comes in a very comprehensive manner and not limiting its therapy protocols only to what is called the gynecological angle, which is a Roga segment, but also a comprehensive understanding and strategy for the same. The Ayurvedic doctor who is treating you, or anyone for that matter of any system of medicine, has the obligation and the responsibility to communicate to you what would be the strategy adopted by him or her for your welfare if you are a patient of PCOD. It's very simple. When it comes to Ayurveda, there is no single entity of diagnosis in Ayurveda that explicitly describes PCOD in one single term. In fact, it's a huge complex endocrinology challenge. It's kind of an umbrella term, PCOD or PCOS. So any Ayurvedic physician will have to definitely cater to the following agendas. One, of course, is a gynecological challenge, agreed. There's amenorrhea to there. There is a dysfunctional uterine bleeding scenario. There is infertility angle to it. And at the same time, we cannot forget the undeniable aspect of insulin resistance, obesity, and the anti-diabetic strategy. All these things make it a battle at different fronts, and that makes it one of the toughest conditions to manage. And if, God forbid, if the patient is a bit complacent and easy cozy with the weight loss and the commitment towards curing the disease, the task of the physician is multifolded. So the science of Ayurveda has a beautiful scope and a very clear narration to any patient or a health seeker to take up the homework and to work for one's betterment. Hence, a modification in the food style with a lower hypoglycemic index natured food, reduction in the fat, a weekly compromise of at least 6,000 calories, a regular pattern of exercise, of yoga, or any forms of energy spending mechanism assumes a lot of importance more than the medicine itself. And that is why it takes quite a long time, 3 to 6 to 9 months up to, for many ladies to conceive who are suffering from PCOD. In fact, we would very promptly communicate anyone that full cure is achievable in a span of a long marathon of 1 year. And that is a very healthy way of retaining one's health. And the long term, the ultimate objective many ladies have is to get conceived, and that definitely happens for the majority. Let us talk about the red flags. Any disease has red flags. So the responsibility of your treating doctor is not just about managing the symptoms. Of course, the symptoms need to be managed, agreed. But it's also about avoiding potential complications of the disease in the long term. Very, very important. Because all of us are aware of the fact that in PCOD or PCOS, the person may get into a diabetic scenario, and even if there's a conceiving, we have a threat of a type 2 diabetes. It's not about the high diabetic levels, it's also about the high cholesterol levels, and then it may implicate to the cardiac ailments, and when the heart is not protected, it's a long-term threat anyway, and worst case, it can end up in the cancer of the uterus in the long run if we are not able to manage the disease in a proper manner. So this is very, very significant. So the most important thing is how to achieve the cure. Obviously, many of the PCOS or PCOD patients, they do conceive with higher chances of fertility is attained when the body weight loss automatically happens. Agreed, but that may not be always enough. So we would always encourage situations in a very natural manner, or even if it's the help of allopathic doctor, to induce ovulation if and when required, if there is a further delay in the progress. At the same time, it is definitely mandatory to have Ayurvedic therapies if and when required, Ayurvedic herbs if and when required, and also to make sure that we do not miss a very important link, the micronutrients. It is very conveniently forgotten by many, and it is very important at the same time. The role of calcium, the role of vitamin D, of the B complex, of zinc, of magnesium, all these have a lot of role towards the maturation of the follicles, the egg maturation, the development of follicles, and promoting fertility in multiple levels of what we call as stakeholders of fertility. In this regard comes the role of regular exercise. The Surya Namaskar or the sun salutation up to 25 a day is easily possible to be attained in a matter of 10 days time, even if you graduate 2 per day every day, 2 sets. It has a very good, gentle but very strong and deep level exercise, the sun salutation. Equally, it becomes relevant the role of sesame, the role of asafoetida, of triphala in reducing weight, and of course, the most famous Shatapushpa, as we call it. This is just a miniature level of prescription, but the most important thing is to get a proper professional advice from a doctor and set your roadmap of recovery with your doctor who is treating it. In the meantime, what we ensure at Athreya Ayurveda Center is that we try to give the best of the impact to everyone using the best conditions of Ayurvedic medicine and also the best diagnostic tools of the Western medicine or the modern medicine. Because many a times a thorough reorientation of one's body situation, a thorough detox of the body that leads to an anti-inflammatory stage in the body, of weight reduction in the body, and also a very peaceful environment for the mind creates the right kind of atmosphere for somebody's conceiving. Because we say in Ayurveda very clearly, Saumanasyam Garbhadharanam Shreshtam, which is a situation where the calmness of the mind, the ease of the mind and the thoughts and the emotions has the biggest role towards conceiving, and that's what everyone needs as the ultimate goal of PCOD in majority of the people. And this is precisely why at Athreya Ayurvedic Center we ensure that the body detox happens in a very detailed and elaborate manner. At the same time, the psychological relaxation, the psychological healing also happens. This kind of body-mind combination approach gives enormous chances of healing and recovery to the normalcy. Obviously, that promotes the chances of fertility quite a lot. And if the situation where the conceiving is delayed or denied, at least the person feels that she is in a better state of health than she was before getting into Ayurvedic therapy process. I hope all these entire details helps some of you to relate to the entire process of discovering your roadmap of healing and to find a better version that you deserve for yourself.